Hi there, I'm Dr. William Stiles talking to you on UrologyAnswers.com. Today we're talking to you about benign, meaning non-cancerous, prostatic, or involving the prostate, hyperplasia. And hyperplasia is just a fancy word for increasing number of cells within the prostate, and what that does is cause enlargement. So when we draw it out, when we draw a sagittal view of the here, this being the bladder, prostate sits here. So when we talk about benign prostatic hyperplasia, or BPH as it's known, what we're talking about is growth of this prostate. And what happens as the prostate gets bigger, it can block the flow of urine. So what happens is the bladder here, the bladder's a muscle, it fills with urine. When it's at capacity, the bladder starts squeezing or contracting. There's relaxation of this external sphincter, and then as the bladder squeezes, urine is pushed through the prostate and out the urethra. So as the prostate enlarges, so you can have prostate tissue like this, where you can see internally the channel through which the urine is passing is now blocked by tissue. Symptoms that can happen when there's blocked flow, a lot of these symptoms are obstructive in nature, meaning, so obstructive symptoms. So that's decreased stream. You know, the stream is just not coming through like it used to. So decreased stream, straining to void, or trying to push that urine out. Sometimes guys will push on their bladder to help give it a little more pressure to push it through. Straining to void, incomplete empty, or the bladder wants to empty, but it can't push through this blockage. So urine can sometimes stay back in the bladder, and so the bladder just doesn't empty efficiently. It just doesn't empty. And so, these are obstructive symptoms. Now, irritative symptoms also can happen because of obstruction, and these are symptoms that involve usually the bladder. The underlying issue is the prostate, but the symptoms are felt at the bladder, and these are urinary frequency, urgency, bladder spasms. Both types of symptoms are present with BPH, with obstruction. When you look at things like that, there's a lot of different treatment options for dealing with. I always like to start with behavioral things that can help any issue, regardless of what it is medically going on. There's almost always something behaviorally that you can do to change your behavior that will help with these issues. So behaviorally, what you can do is cut back your fluids, and just be reasonable. Your body needs to be hydrated. You need water and fluid. But if you're drinking, 6 liters of water and you're urinating all the time, that's the first thing you probably should do, is cut back those fluids. There are also bladder irritants that can irritate the bladder and cause worsening of symptoms. These bladder irritants, the most common ones are alcohol, caffeine, citrus products, even carbonation can do it, or acidic foods. Removing bladder irritants can help your bladder settle down so that it's less irritable and allow the bladder to empty a little bit more efficiently. So these are some basic things behaviorally that you can do: cutting back your fluids, cutting back your bladder irritants, and then just emptying your bladder. When you feel the urge to go, don't hold the bladder. Just try to empty out the bladder, and try to get it to empty out all the way, more efficiently, if you will. Now, there are many medications you can use. There's a group of medicines called alpha blockers. And these are medicines that relax this area in here selectively. They selectively relax this area of the prostate so that there's better flow through here. And these selective medicines are Flomax, Rapaflow. There are some non-specific alpha blockers like Hytrin and Cardura, things like that, but they're not used much anymore. These are the main alpha blockers. Mainly Flomax is probably one of the more common alpha blockers. Now, there are medicines that decrease the size of the prostate. These are very effective medications that over time, alpha blockers, they work right away. Usually within a couple of days, you'll see a benefit if they're going to be helpful. Now, the medicines that shrink the prostate, the two medications are Proscar and Avodart, but these take some time. These medicines may take 3 to 6 months to shrink the prostate well enough to really see an improved flow. So when you're dealing with acute symptoms, usually you're going to put someone on alpha blockers first to kind of see what their response is and things like that. So 2 different medications, medicines that relax the prostate and then a medicine to shrink the prostate. Now, these alpha blockers, they don't do anything for the size of the prostate. They just relax the prostate. And likewise, these medicines for the decrease the size of the prostate, they don't do anything for the tone of the prostate. They just shrink the prostate. So that's where most people will start when they're dealing with BPH or urinary symptoms due to prostatic enlargement. A lot of times I'll start medicines on patients, do some behavioral therapy, give someone, a good 6 weeks to kind of see how things go. And if things don't get better, usually the next thing to do is to actually look in that bladder and see what that prostate looks like. Is it obstructed? Does it have are the lobes blocking the outlet? Is there a big middle portion of the prostate? You can have what's called a ball valve middle lobe of the prostate that acts like a ball that when you're urinating, that ball just jumps up and blocks that whole channel. So cystoscopy is important to evaluate that area, and also the bladder. It's not just the prostate you want to preserve, but the bladder function needs to be preserved. This bladder is working hard, and if it's working hard and can't empty, over time, this bladder can lose its ability to function appropriately. So you also want treatment to help preserve bladder function. So that's important when you look at BPH and things like that. It's not just the prostate, it's also the bladder that you're trying to preserve. So that's it. That's a basic overview of BPH. There's so much more to it. A lot of things I left out, but just the basics of that. Hope that was helpful. I'm Dr. William Stiles, board certified urologist, talking to you today about BPH, benign prostatic hyperplasia, on urologyanswers.com.